Start stream, and we should be live now. Hello everyone, good afternoon, and welcome to another DentalShadowers virtual shadowing session. Today we have Dr. Hanson, who is a cosmetic dentist, and he's prepared a great presentation for us today. So Dr. Hanson, whenever you're ready, you can take it away.
Thanks, Krupa. So yes, my name is Dr. Marshall Hanson, and I'm excited to be here. Thanks for inviting me to visit with you. I really want this webinar to be personalized to the extent that it's possible, so that it can be valuable for you. I'd like to know a little bit more about you, the audience, so that I can kind of tailor what I say, how I say it to meet your needs and be as valuable as possible. I don't know, Krupa, if you're able to invite people to come on and share a little bit, or if you just kind of generally want to tell me about the audience so that I can talk more specifically to them.
Sure, of course. So we're streaming this onto YouTube Live, so I don't know if they'll be able to come on, but I can let you know most of our audience is pre-dental students. And so some of us are applying this year, some people are applying later, but mostly pre-dental students.
Okay, so everyone that's listening is interested in and pursuing a career in dentistry, and they're just getting ready to go to dental school. They're in the process of applying and selecting their schools. They probably just finished taking the DAT, etc.
Yeah.
I remember those times. Yes. Okay. Do we have an idea about how many are in the audience today?
I think Yoon could probably check right now, but usually we have around 50 to 100 joining live, and then afterwards people will watch the recording.
Okay, so it's recording too. Awesome. Okay, well, great. So all of you are dental students. I just want you to know that I loved my dental school experience. I went to the University of the Pacific, Arthur Agoni School of Dentistry in San Francisco. And I just absolutely loved what I learned there, how they treated us. It just really inspired me. So I love dentistry. And basically what I do, I graduated in 2007. So I was in school from 2004 to 2007. And I really didn't know a lot about dentistry beforehand. In fact, I was studying to take the MCAT and go to medical school. To be some kind of doctor. I wasn't sure what kind, but I figured I would need to specialize in something to at least be good at one thing. And I happened to shadow a dentist as I was searching for different medical specialties. And it really opened my eyes to all the artistry and the hands-on work that we can do and the influence or impact that we can have on our patients. I love that it's a family-friendly schedule. And I've always been interested in art. I love to sculpt and draw, make things with my hands, sew, whatever. And I found that there's so much of that. There's so much artistry in dentistry, and that's where some of my passion is with what I do today. So what I do now, I've been out of school for about 13 some years, and I help individuals feel extremely confident with their smiles so that they can enjoy happier, more positive lives. And I do it using non-invasive treatment options, namely clear aligner therapy, like Invisalign, for example, and direct composite veneers. The two things that I am most passionate about are seeing how enhancing people's smiles. Most of my clients come to me because they feel self-conscious with their smile. They feel like it's held them back in some way, whether that's been their professional world or in their relationships or just even in their own self-confidence. And so enhancing their smile is done. I love what it does for people in their lives. I think that they do lead happier, more positive lives when they smile more, when they feel happier, when they feel more confident. So I'm very passionate about that and the value that that can add to people's lives. And my second passion is non-invasive dentistry. I feel very strongly about doing things in a way that does not require that we shave down teeth, irreversibly remove enamel off of teeth in order to accomplish this. So I've spent probably about 10 years developing new techniques, working with different materials to be able to offer a smile enhancement in a non-invasive way. Um, I, I started focusing in on cosmetic dentistry when I was in dental school. And I'll just share with you, just because this is kind of where you guys are right now, my experience when I went into shadow dentist for the first time, because this really kind of ignited a fire for me and what I wanted to do and currently do now. So it was early in the morning. I'd never shadowed a dentist before, didn't really know a lot about dentistry. And it was early in the morning. I was meeting with the doctor and the patient came in. And this patient was probably in her late 40s, maybe early 50s. I knew that she worked for a plastic surgeon and she was otherwise relatively attractive, except her teeth were very dark and misshapen and a little visually distracting for everything else about her. And so I watched this dentist do whatever he did. I didn't know what he was doing, but the part that had the impact on me the most was at the very end of the treatment. And what he had done for her was he was doing 10 porcelain veneers. And so he had prepared her teeth and made her temporaries. And so at the end of the appointment, she had her temporaries in and he handed her a mirror and set her up and let her look at her new temporary smile. And she just started to cry and she grabbed his arm and she just looked at him and said, "Thank you, thank you." And in that moment, I saw in her eyes what she felt that he had done for her and that it was going to be life-changing. And I still feel a little bit emotional about it because it hit me so hard in that moment. And I was like, wow, I want to be able to do that for patients. If I can be that kind of value and influence someone or help someone on that level, just what I could see in her eyes, like that was it. That's what I wanted to do. And so I absorbed everything that I could about cosmetic dentistry, about dental anatomy, about smile design when I was in dental school. And I made it a goal for myself while I was in school to work toward becoming an accredited fellow in the American Academy of Cosmetic Dentistry. If you're not familiar with what that is or what that means, in my view, it's currently the closest thing that you can get to being recognized formally as a specialist in cosmetic dentistry. Because as you know, there are different formal specialties like pediatrics, oral surgery, orthodontics, prosthodontics, etc. Cosmetic dentistry has yet to be identified on its own as a formal specialty. But this right here is becoming accredited or an accredited fellow with this academy is the closest thing to being recognized as toward that. So I worked toward that. It took me 10 years to accomplish that. And anyway, it's just kind of become part of my passion for creating beauty and smiles and making the dentistry undetectable. So currently what I do is I now work, I work in a practice. I lease an operatory. So if you were to ask me a question, well, what's your current situation like? What's your workday like? What do you do? So I lease an operatory from a friend of mine who has a dental office. So I'm just paying for the space of one operatory. I have one assistant and that's it, just me and her. And I see 2 patients a week. One patient I see Monday through Wednesday and another patient I see Wednesday through Friday. So it's about a 48-hour window, a half day, full day, and a half day that I see each client. And I just do exclusively direct composite veneers for individuals who want to enhance their smile and do it in a non-invasive way. There are many people who feel self-conscious about their smiles and want to change some things. Maybe they feel like their teeth are too small or they're dark or they've been chipped or they don't like the proportions or the color of their teeth. But they are hesitant to do anything about it because they don't want to shave down their teeth. And so what I'm doing is offering them an alternative, another way to enhance their smiles without shaving down their teeth. It's a completely additive procedure. It's non-invasive. We do it with direct composite. I'm excited to show you what is possible with that. But before I do, I just want to show you a fun little video. If some of you are not familiar with cosmetic dentistry or how people can respond to this type of work, have a look at this short video. These are patients who are looking at their smiles for the first time.
Holy.
Oh my goodness.
Oh,
Babe, you look amazing. Come on, just do it. Oh my gosh.
oh my
You
gosh.
don't even look like the same
What?
person. Oh my
They look so
god.
Whoa. Wow. Wow. That is really good. Oh my god. Are you kidding? Clark. That's nice.
Time 3, 2, 1.
Oh my gosh. Oh, you're kidding me. Holy crap!
Whoa.
That's so good! Oh my gosh.
Whoa, look at
Holy!
So as you can tell, people, this really can mean a lot to them. It can really change their lives, their outlook, how they feel about themselves. And that really can influence everything about their everyday experience. So it can be really rewarding. But I want to do a short presentation here for you, a little bit about the world of cosmetic dentistry, where it is now, where things are going, and then open up things for questions. So our world of cosmetic dentistry is different than it was 20 years ago. And the difference is that we now have the advent of phones, computers, the internet, social media, Google, YouTube videos like what you're just watching right now. And so there's so much information out there for the patients that wasn't currently or wasn't available as it is now today. So much information. So if you were interested, if you were a potential patient and you're interested in improving your smile, first place you're going to go now, and not 20 some years ago, but now, first place you're going to go is online. You're going to type in improving your smile or something like that. So what I want to show you is what's available out there when patients are searching for things. So I just did a search here on Google, and I typed in some things like cosmetic dentistry or improving my smile. And these are some of the things that came up, and I'm sharing them with you because this is what patients are finding. They're learning what traditional tooth preparation looks like. What I mean by tooth preparation, as if you're early or new into dentistry and what happens, the reshaping or the shaving down of natural teeth in order to accommodate a crown or a large filling or a veneer. So people are seeing what that looks like and they don't want it. They want to preserve their natural teeth. They don't want to shave it down. It scares them. And here you'll see why. So these are some things that I just found online, again, with just a regular search. These are quotes and pictures that were associated with that. Patients that have posted their stories online. This one said, preparing my teeth, I learned, meant grinding them down to little nubs. Quote, he said he would need to roughen my tooth enamel to enable the veneer to stick. I wasn't surprised, therefore, when he numbed my mouth and started polishing away. When I looked in the mirror, I saw my previously healthy teeth had been drilled down to tiny, misshapen stumps. Kind of makes your heart sink, or at least it does mine. I went to run my tongue over my teeth, and it recoiled like a slug that had been salted. What was left were short, pencil-like pikes. I looked in the mirror and shuddered. Nosferatu grinned back at me. And I didn't know who Nosferatu was, so I had to look him up, but here's a picture of him. You can see some of the resemblance there. And then he continued, no changing my mind now. So in 2012, there was a report that claims against dentists involving porcelain veneers had doubled between 2005 and 2010. I should do an update to see where things are now. And in 2015, the UK's 6 leading specialist dental societies published a dramatic joint statement in the British Dental Journal expressing concern at the risks of increasingly popular cosmetic dentistry, describing cases of permanent damage to teeth caused by veneers as a worrying and growing problem. Here's the journal entry there from the British Dental Journal. Quote, the desire for the alleged perfect smile needs to be tempered with an awareness of the significant risks, they wrote. They also suggested ethical problems with some dentists not being honest about the risks, namely that aggressive reduction of sound tooth tissue results in structural weakening of the teeth. Here's another article that I found. Dr. Christopher Dean, a dentist who works with specialist legal firm, the Dental Law Partnership, says, quote, drilling can trigger inflammation and swelling within the pulp, causing excruciating pain. The swelling can eventually strangle the blood vessels supplying the tooth. This causes the nerve to die and so kills the tooth. He says 1 in 10 veneered teeth will need root canal treatment to remove the dead pulp and nerves and clear infection, followed by a crown, which requires more of the natural teeth to be removed. If you have 16 or 20 teeth veneered, you will likely need root canal treatment for at least 2 teeth, which you risk losing entirely. That's because as many as 10 to 15% of root canals fail, he says. This will cause more pain and need another root canal or surgery plus a new crown. And if that fails, the tooth has to be extracted. And every time you replace your veneers, you put them at risk again, says Dr. Hill. I have seen people in their 50s losing teeth after having veneers in their 20s. The next step is an expensive implant, a bridge, an artificial tooth with a crown on either side, or dentures. This is the type of information that patients are finding as they're doing their own research out there. And logically, as you can see, as they find things like this, they're going to be scared and worried about having their teeth shaved down, especially for cosmetic procedures or elective type procedures. So what I believe is that more and more consumers are seeking solutions to their dental aesthetic concerns that require little to no irreversible removal of their natural tooth structure. And I believe that those doctors who can confidently offer their patients highly aesthetic yet minimally invasive treatment options will be increasingly sought after. And you, as you get into dental school and pursue the path that you choose, this is something that you can do also. I think that it's good for patients to be less invasive. It's good for our profession, for the outcomes, and for how we feel about the work that we do. So I'm going to share a case with you here that I did. I used to make all of my own ceramics. I did my own veneers, my own crowns. I was too particular to send things to a dental laboratory. So I taught myself, I learned how to do it, and I was doing that myself. And so here's a case that I had posted a number of years ago because I was proud of it. Here was a case here. I did some gingivectomy. I was minimally invasive in my preparation. I tried to use depth cut burrs and a wax up and shaping the teeth so that I could make temporaries and design the veneers on the model afterwards. So even though I felt that this was minimally invasive preparation, because I've always felt strongly about that there were still some negative side effects or some limitations to this procedure. This was a younger patient as well. And I know nowadays that if I had this case to do today, I would definitely do it in composite, and I would get a prettier result, and I wouldn't have to shave down the teeth at all. It could be completely additive. This was the case here afterwards. And just one of the limitations there, like I felt like I accomplished a nice blend. I think the sizes and the proportions were better. However, if you were to see this patient talk, we both agreed that the veneers may have been just a little bit long. Would have been better for her face just to shorten them a little bit. If that were composite, that's so simple to do. But here with porcelain veneers, it's a little different story to do. So there are some limitations as well of not just removing tooth structure, but also modifiability. You know, if you want to change things, take away, add, modify the color. It's really easy to do with composite, more difficult with ceramics. So what's possible today, I'm going to show you this short video just so you can see, if you're not familiar with direct composite, how it works. So this particular patient had dove into a pool. You can see how she cracked the tooth and cut her lip. So she'd broken her front tooth. She'd put a crack in the other tooth as well. And so I just want to show you how we could clean this tooth, rebuild it in a minimally to non-invasive way. So here's the close-up pictures. You can see kind of the diagonal fracture on the other tooth, the other central incisor, which would be number 9 if you're familiar with that. And then there, how it was broken. So this is that was the tooth piece that fell off and it wasn't a good fit anymore. So I'm just cleaning the surface here. My intent is not to remove any volume of enamel. I just want to scratch the surface, make sure there's no old adhesive, there's no plaque, there's no film on the tooth, and that we've removed what we call aprismatic enamel, which is just a few microns on the surface. But I'm just cleaning it, not removing the enamel. And then this is to sandblast the tooth. This is an air abrasion instrument, small fine particles that sandblast the surface and improve our ability to bond composite or filling material to the tooth. So after it's been all cleaned and it's ready to bond, I'm just applying some barrier here on either side. Let me turn down the volume on my computer here. Sorry, all the air is a little distracting. So this is bonding agent or adhesive that we apply to a tooth. This allows the composite to stick to it. And currently we can get a bond strength of composite to tooth about the same strength that enamel is bonded to itself. So really this material kind of becomes part of the tooth. It's about as strong as enamel, and it can look incredibly beautiful and natural as well. So here I'm just placing the material on the tooth, smoothing things out, getting ready to harden or cure the material. And now it's a little bit overbuilt, and so I start shaping the composite back to get the 3-dimensional primary shape that we want. So in dentistry, you have sanding discs, you have diamond burrs of all sorts of different shapes and different coarsenesses, and you can utilize those in whatever sequence to help you accomplish the shaping that you want. So the other tooth also had a little fracture in it and some old composite on the surface of it. So I'm just removing that composite off the surface. I do this dry, there's no water spray. It's easy for me then to see where the composite is and where the tooth is. If I'm using a dry burr, the enamel will just look shiny. If it's composite, it'll look powdery. So that way I can tell where I am and preserve the natural tooth. So what I'm doing here is I'm removing some of the composite so that I can apply some colors, some tints, where we can add gray, we can add orange, we can add white effects. Because natural teeth have so many different colors in them, if we want our composite material to blend in, we've got to find a way to mimic nature and add in those effects and colors as well. So the blue material here is an etchant or a conditioner we place on the enamel. Here's the adhesive. And now I'm just going to apply a thin clear layer and some colors to make these look natural. So this is a gray tint, a gray color. So if you like artistry, if you like to paint, if you like colors, there's a lot of that in dentistry. So I'm just applying some natural effects that normal teeth would have, using some blue, some gray, a pink opaque, and some whites. And with composites, you have different translucencies available too. You can place a composite toward the bottom edge like I am that's more translucent like natural teeth, and you can use materials that are more opaque and allow less light to go through them. And then this is the clear layer that I'm going to be applying to the surface. When it's clear, you just have to make sure there's no bubbles. That's why I had to redo it there. So this clear layer goes on the full surface of the tooth. Personally, I don't like to leave any finish lines right in the middle of the tooth, so I extend this clear layer up toward the top of the tooth. And that will help its visual longevity, look better for longer. So you'll notice that this patient has kind of a clear mouthpiece in. It's out now, but when we're bonding, it has a high volume vacuum, so it removes humidity from the patient's mouth while you're working. And that also improves our bondability. If we can minimize the moisture that's on the tooth, we'll get better bond strengths of our material to the tooth. So now I'm just shaping back that clear layer that I put on and kind of blending it into the tooth and reestablishing the basic three-dimensional shape of the tooth. So in order to be able to do cosmetic dentistry or procedures like this, you really have to have a good understanding of dental anatomy and smile design principles. So you'll learn that in dental school, and you'll continue to learn that forever after. But you have to be able to envision it first in your mind to be able to create it with your hands. Some of the best books on smile design is actually one resource from the American Academy of Cosmetic Dentistry. They have an accreditation workbook, and there's a little pamphlet you can just order from them online. I think it's maybe $50. But it goes through and talks about all the principles of smile design. And I feel like that's one of the best things. If you really want to get into this type of work, that $50 book will be one of the best resources for you in training your mind and your eyes to see basic shapes, principles of smile design, so that you can reproduce that when you're either evaluating lab work back from your ceramist or building it yourself with composite like this. So you can see that these teeth are just starting to take shape now. I typically like to overbuild my composite and then shape it back and continue to polish it as I get closer to the finished result. So I'm just continuing to finalize the shapes. Hopefully you find this interesting.
It's amazing how it looks like just what it was before.
Yeah, this is the kind of stuff that I do every day, and I love it. So this is just this is another one of those sanding discs. It's just finer, And I'm using the pencil to highlight the line angles, kind of the heights of contour or the prominences of the different shapes so that they go together. Those lines kind of flow together from the teeth I'm working on to the ones next to that. So there's a lot about balance and harmony with smile design, making things look pleasing and, like I said, harmonious with everything else the patient may have. So here I'm just finalizing kind of the finishing touches, but you can see already how the edges of those teeth are starting to have some natural effects to them. And then now that we have the basic shapes, the primary shapes there, we're going to go in and put a little surface texture and final polish on these. It'd be nice if we could really work this fast, but this takes time. Thought we would accelerate it though, just for sake of time today. So when you're polishing material, you're just going through a series of making scratches in the material that are finer and finer and finer scratches till eventually you end up with a really polished surface. So you can see that shiny surface has some texture just like natural teeth have. It's not like a perfectly smooth polished surface. It's got texture like skin or like a landscape. If you just study natural teeth, you'll see all the little details that natural teeth have. And it's those details or attention to those details that can make things look beautiful and natural, like we see in nature. All right. So finishing touches here, just about done. So we were able to restore that tooth and preserve her natural tooth. We didn't shave it down and put a crown on it, but here you can see how beautiful that can look, how natural that can look, and still be non-invasive. And that's what more and more patients are looking for. They want things to look natural, they want things to look beautiful, and they don't want to sacrifice their tooth to be able to accomplish it. So again, if you're looking into cosmetic dentistry as something that you want to offer or get into as you pursue your profession, I strongly believe that non-invasive treatment options are going to be what everyone is looking for, especially when they can look this nice, it's predictable, easy to repair over time if needed. One thing I'll mention about composites, that not all composites are the same. Some are stronger than others, some maintain their polish better than others, some can discolor with time compared to others. I found a material that I love that is extremely color stable. I've seen a personal case of mine from 13 years ago on my mother-in-law who drinks coffee, and I haven't seen the composite discolor in 13 years. I've seen another doctor's case with the same type of material, 22 years on a coffee drinker, still the same color as it was. I was able to compare an original shade tab to it. And this material actually gets more polished over time rather than less. So as you're deciding what materials to use, just recognize that not all composites are the same, and you want to find one that is highly color stable and polish stable so that you can offer your patients better longevity. So with direct composite, all these cases that I'm going to show you were all non-invasive, completely additive. I just cleaned the surface and added to them. So we're not shaving down the teeth. And in a lot of cases, there was already enamel that has been lost or thinned. There's no reason to take away more of that. But you can see how patients that may be self-conscious about the shapes of some of their teeth or a lack of proportion or balance, how, again, in a non-invasive way, we can even out the gum line, resurface those teeth, fill in the smile, change the color and the shapes and the balance, and really change people's lives without shaving teeth down, which I think is so exciting. This is just direct composite. Lots of different cases. Each case is unique. Each person has their own character, their own art shapes, personality. And as a tooth artist, in a way, you have the ability to weave all those things and take that into account as you're designing a smile. And it can even be subtle. I mean, you look at this before and after, and you're like, that's not too different. It still looks like her, but there's definitely some enhancement that's happened. And to know that it was non-invasive, like that this could actually be reversible. If I really wanted to, I could carefully remove all that composite and put her back right where she was before. That's comforting to a lot of patients as well as us as doctors. Here's a little video. You can listen to her talk. So here, I just want you to see the difference, the dynamic difference as the patient talks on one side and the other, to see what a nice enhancement things like this can make to really help people feel more confident.
And care in talking to me about what was going on with my bite, what could be impacting, and just the small tweaks that can make a huge, huge difference. And so that's one of the highlights of my experience, not to mention my absolutely stunning smile, which I'm so excited about, but wins in more ways than one with Dr. Hanson. And it was clear and concise and just an incredible experience.
So again, this is just before and afters, direct composite. I'm showing you these just so you can see the variety of what's possible without shaving teeth down, to be completely additive, and the artistry that can be involved, how pretty these materials can look. Even if we're doing implants. So here was an implant case. Patient had a baby tooth that had become loose and had to come out. An implant was placed with a gum graft, and I was able to create a composite crown on that implant that I could then customize. I could influence the polishability, the color, the effects, the translucency, and really make that undetectable. And that's really hard to do with ceramics. Trying to communicate that to a laboratory can be very difficult. At the place where I work now, we have a ceramist here in the office that to improve that communication, where he can come in and look himself with the patient there too. But having the ability to do it right there, chairside in composite, really makes things so much less stressful and more predictable. Here's another implant case. A coworker of mine placed the implants, did the gum work. Gums and implants look so nice. And then I just had to finish it by just adding 2 composite restorations on those implants. And you can see the surface texture, the color, just how nicely that can just harmonize with the surrounding teeth. In this case, we just added to the 2 lateral incisors. They were just uneven and a little short, so I just added some length, only treated those 2. And here up close, you can see a natural tooth on the central, and then the other tooth is a composite veneer. You can even take cases like this, and in a non-invasive way, without shaving down the teeth, you can improve things for someone like this.
My mom has always been insecure about her smile. So,
oops. Let me back up here if I can. I want you to see this little video here. It's kind of fun.
My mom has always been insecure about her smile. So me and my sister entered her into a contest on Instagram to win a free set of veneers, but didn't end up winning. We didn't let that stop us from giving her a new smile. The dentist was located in Utah, so we bought her a plane ticket and a place to stay for 3 days. So here's us flying out to Utah. She was super excited, but also super nervous. As soon as we got there, he wasn't hesitating to get started. The dentist, Dr. Hanson, was super nice and decided to give us a discount since we wanted to surprise her with a new smile anyways. A few days later, she had a big reveal. This is a before and after. Ever since we got home, she cannot stop smiling.
So cool. These two daughters decided to save their own money and bring their mom out to do something nice for their mom because they loved her so much and felt like she had done so much for them.
Thank you, Dr.
Thank you.
So exciting. There's her case there too. So even tetracycline or stain discolored teeth, you can just resurface them, hide the color underneath, and improve things. So just tell me, how do you feel about your new smile?
Amazing. It took a minute to get used to a perfect smile, but I'm loving it and I'm so happy. And I think now when I smile loudly like I always do, it won't be like embarrassing when I see the candid shots of my gray teeth. Now they're just pretty and I'm so happy. It's amazing. And I have friends asking me who they'd contact to get it done and everything. So you'll be expecting more.
If there are gaps between the teeth, chips, this can be added to the teeth. You can close gaps, you can change the shapes, the color, the proportions of teeth in a non-invasive way. Again, we didn't have to remove any enamel. This is all additive. And the great thing about it being a non-invasive procedure is there's no age limitation. You can treat a 14 or 15-year-old and feel okay about it because their natural teeth are still intact underneath. And especially during those ages when they're in high school, their confidence is so important. It influences so many of the decisions that they make and the crowds that they hang out with. Like, I really think that being able to help someone like this, I mean, this patient had just finished braces and he still was very unhappy with the looks of things. But being able to offer our patients something non-invasive that can help them in that critical time in their life is really rewarding and fun. White spots, gaps, proportions, asymmetry. So that's what's possible, and maybe even more than that, because things continue to improve and get better over time. But if this is something that you are interested in and you want to do it, or interested in pursuing it or learning more, there's definitely some training involved, because you're not sending this out to a lab technician. This is something that you're creating with your hands and your eyes for your patients. So there's training. Personally, like, I love to teach, and something that I regularly do as well. So when you get through dental school, if this is something that you still want to reach out to me and find out more about, I teach composite veneer courses. I have a virtual mentorship online to help people implement these and help doctors offer less invasive treatment options to their patients. That's really the goal. There's very few doctors who are doing this currently, and I just think there's so much room for more less invasive dentistry. But I teach courses here at the center where I work here in Utah. Doctors will come in, we'll have live cases, we work on models and work on our skills to develop this technique to offer our patients. Here's a short video here of one class that we had not too long ago.
I first saw Dr. Hanson's work and I was attracted to it because of how beautiful it was. When I looked into it further, it was also interesting in how he did it. It was very different to a lot of the other composite courses that I've seen where they build it up in layers. This is almost the opposite.
I follow a lot of dentists. I really do think he's probably the best in the world at what he does.
What I loved most about his work is how natural that it looked. Even in composite, his work looked more beautiful and more natural even than a lot of porcelain restorations. I
like the combination with this course of it being hands-on and then also a live patient. Like that was really great that he kind of jam-packed that into this weekend of having both of those.
I feel like he just has these tricks that seem so simple, but they're literally like, it's like a light bulb, like, oh, that's how you do it. Totally makes sense why he gets consistent results, because he has this technique and he follows it step by step. And I think just his attention to detail is like what makes his end result just so awesome.
Be able to take Dr. Hanson aside and ask him to show me right in front of my face, right with his own two hands, each individual step was very helpful. Just to be able to actually see him do it and then be able to copy that and have his critique, I think that's super helpful for me being able to do that in the future.
The online course was great because I feel like when we started the in-person course, we were kind of a step ahead, and it just really helped the in-person course make a lot more sense.
He's able to simplify things, explain things really well, which is really nice for me, because you get up there and you say all these crazy terms, he breaks it down really easy for you to understand and to pick up those things.
I've been to many courses, and it's really refreshing to see someone that's actually very authentic, someone that's very passionate about the smile design, the whole process of composite dentistry, and he really believes it.
There's a lot of, I don't know if you want to say gurus within the dental field, and a lot of them aren't willing to share their knowledge and their skill set with you, and he's just very approachable and just very giving with his time and knowledge.
Overall, this course was just absolutely incredible, and I would highly recommend it to anyone.
So direct composite is cool. It's fun. If you like using your hands, making things, you can do so many good things for your patients. So I love what I do. I'm so glad I could share what's possible with you and hopefully inspire you to think less invasive when you're treating your future patients and looking at different options. So thanks for letting me share this with you. I'd love to answer any questions that you have and further customize this for you. Thanks, Krupa.
Awesome. Thank you, Dr. Hanson. I really enjoyed seeing all those cases. It's so amazing what you can do with non-invasive dentistry.
Thanks.
So Yuna's going to take a few questions from the live chat now.
Yes, we have a few questions. So the first one is, how did you prepare for your DAT?
All right. So I had been preparing for about 6 months for the MCAT because I was going to go, I thought, to medical school. So I took a Kaplan course and I had lots of workbooks and I studied every day for those things. Fortunately, the DAT is very similar to the MCAT for medical school. So much of the stuff, the biochem, the anatomy, the biology, the things that I was studying for that translated over, and I was able to feel prepared taking the dental admission test. But I would suggest do well in your classes, make note cards that I'm kind of nerdy, but I would make note cards from my reading of my chemistry or biology classes, and I would wear those around my neck when I was at college. So anytime I was walking between classes, I was flipping through, looking at my note cards to study and to make it sink in and stay. So there's lots of different techniques, but I do recommend courses. There's a lot of workbooks or online ways, I'm sure, to do that now too. But get familiar with the testing process, because there's a lot of really smart people, but it doesn't necessarily mean that you know how to take a test. So there's test taking skills that you'll need to learn to do really well on that and improve your chances of getting into dental school.
The next question is, why did you choose cosmetic as your specialization?
So I love the artistry in it. Like I said, I've always loved to draw and sculpt and create things with my hands. And so I love that, all the artistry that's in dentistry. So it's rewarding for me to be able to be involved in that part of it. Like I said, I even was making my own ceramics and crowns and inlays and onlays and things like that too, because I love the artistry, and I just always had a passion to see how could I make this dentistry look undetectable. That was my goal. And so it just fell into that. I think surgery is fun. Orthodontics is fun. Endodontics, root canals are fun. I used to do those all myself too. But I just found this to be the most rewarding for me. And I feel like the best alignment with my skill set and what I believe in the most, which is non-invasive dentistry. I feel like that there's just too many teeth getting shaved down for money, really, because crowns make more money than fillings. And I feel like it's unfortunate. And I think if we can do a great service for our patients, charge fairly for it, and help people preserve their tooth structure, I think all the way around it's a win.
The next question is, do less invasive dental procedures usually cost more or less than other cosmetic dental procedures?
So good question. If we're moving teeth to get teeth in the right position first, like if we're using clear aligners like Invisalign, for example, the cost of that's going to be the same probably wherever you go. As far as composite veneers versus porcelain crowns or porcelain veneers, yes, for specialty work, they are less expensive than porcelain veneers if you're comparing specialty fees. But they're also less expensive biologically because you're not having to pay the price of losing your enamel to accommodate a porcelain restoration. So yes, in both ways, they are less expensive for patients to do a non or less invasive treatment option.
Would you say that a cosmetic dentist needs more of an artistic ability?
It helps, like I said, because you're creating aesthetics. You have to create something that gives a pleasing sense when you look at it. And so there's definitely some art sense about it. So I definitely think that it helps. I don't think that you have to have it. I think that's something that you can develop over time. Let's say you just haven't worked on that or haven't developed that to this point. That doesn't mean that because you didn't practice it before dental school that you can't afterwards. Just like I've never really juggled, but I'm certain that if I spent a few years working at it, that I could be good at it if I tried. So there definitely are some artistic principles. There's a lot of math, a lot of color, a lot of science as well in it. I think you just have to enjoy it, and the learning part of it will just come naturally. But yeah, if you don't consider yourself an artist, don't rule yourself out. These are things that you can learn over time.
I guess branching off of that question, did you feel like you had a strong artistic talent prior to dental school, or were you able to develop these skills in school?
Yes, I did. Before dental school, I loved to draw. I liked drawing with pencils. I liked to draw landscapes. I used to make creatures out of clay and gift them away to people. Like I always loved making things with my hands. So yes, I do feel like I did have some skill set there, but I've definitely developed it as well. I've built upon that over time.
And in what ways do you advertise your business, and in particular distinguish the cosmetic aspect of your services?
Yeah, so the only advertising that I do right now is I post my cases on Instagram at Marshall Hanson Dentistry, and my patients or potential patients find my work on Instagram, and there's a path for them to find out more. There's an introductory video, and then they can request a personalized virtual consultation regarding their goals and their smile and what's possible. And then if that all seems like a good fit, they can schedule online and show up. And then I basically just have 48 hours with my patients to accomplish results like you see on the screen. So I just do Instagram. That's all I'm doing right now.
What do you need to do to be part of the American Academy of Cosmetic Dentistry?
Great question. So you can just go onto their website at the aacd.com. You can become a member directly on there, and you'll have access to all of their journals. They're incredible journals, work like mine that you can see other doctors are doing as well. That's just exquisite work. Then, in fact, those journals and the American Academy of Cosmetic Dentistry is what inspired me early on. When I was looking at their journals, I was like, wow, like I couldn't believe that what they were doing was possible. It just looked so beautiful and so natural and so undetectable. And so I decided early on, like, I want to learn to do work like they do. And so it's really been an inspiration for me, and the whole accreditation and fellowship process through their academy has been really helpful in helping me get the skills and the ability to do this work and have something to measure my work against. There's a standard there to aim for, and I could see where my shortcomings were over time and how to fix those. So just go on to their website. They have so many good resources there, like that Smile Design book I mentioned, all their journals. And they do have incredible scientific sessions where you can do hands-on workshops and lectures and learn from some of the best dentists out there.
Thank you. I think that's all the time we have for questions today.
Okay,
Awesome.
Thanks for your questions.
Thank you, Dr. Hanson, for answering our questions and for opening our minds about non-invasive dentistry.
Yeah, you bet. And you can reach out to me at Marshall Hanson Dentistry on Instagram. You can just message me, and I'm happy if you have extra questions. If your question didn't get answered for sake of time, you can just message me. I'm happy to reach out and help you in any way I can.
Great. Thank you so much. And thank you, everyone, for joining us today.
Dental school is great. Great profession. You can do so much good out there. So good luck to everybody.
Awesome. Thank you, Dr. Hanson, and have a great day, everyone.
Thank you.
Bye. Thanks.